Welcome, everyone, to the La Jolla Cosmetic podcast. I am here with Anastasia Chu. She is one of our PAs in our Carlsbad location, our new Carlsbad Med Spa, and she's coming to us from that med spa today. And welcome back, Anastasia.
Thank you very much, Monique. Thanks for having me here.
So this is going to be fun because we have some amazing technology that I can't wait to be the patient for. And it's Morpheus8. So we talk about collagen a lot on this podcast. We talk about collagen remodeling and things that stimulate collagen. And so today we're going to talk about Morpheus8. And so Anastasia, what is this treatment all about?
Yeah, so Morpheus8 is a safe and effective treatment option that utilizes radiofrequency with microneedling technology to give the face and skin improvement in their collagen production and elastin so that we can restore a more youthful appearance.
So how is it different or better than regular microneedling?
I like to think of it as it's more powerful than regular microneedling. You take your regular microneedling, but you add the radio frequency into it, and that amplifies the collagen production, so it enhances your result so much more.
And so microneedling is like creating a wound, right, on the skin, sort of. And then does the radio frequency stay surface level or penetrate?
It is penetrating to the specific level that we need to address a specific skin concern. So it is placed deeper into the skin, not on the surface like lasers.
And I guess what are the kind of conditions that people might be trying to treat?
It covers a wide variety of skin concerns that people can treat for. So lines, wrinkles, skin laxity, skin firmness, skin stretch marks, chronic acne scars. It can treat a wide variety of conditions.
And I've seen pictures of you guys obviously doing it on the face, but I've also seen like somebody's tummy being done. So what are the areas that you could treat, and what, I guess, if you were treating your tummy, for instance, what was that person's concern?
Yeah, on the abdomen, it's a very popular treatment to address laxity. A lot of times after pregnancy, people stretch out their tissue. So it can help address the tightness, firmness of the skin in the abdominal region, and also sculpt fat. With radio frequency, we can turn up the heat and melt away fat or difficult fat pockets that we just can't address no matter how much we diet and exercise.
Wow. Okay, hold on. All right. I did not know this. So I'm like blown away at the moment. So my brain is going crazy thinking of all the places that I have fat that I would love to have treated. So does that mean like, how would it differ then for pockets of fat for CoolSculpting versus this?
CoolSculpting addresses the adipose tissue and addresses fat alone, whereas my radiofrequency microneedling, such as Morpheus, it targets so many different problems of the skin, not just help melt or sculpt fat alone. So you get more benefit doing radiofrequency microneedling. In terms of reduction in fat, the CoolSculpting will have a better reduction with one treatment. So about 20 to 25% with CoolSculpting versus 10 to 12% with Morpheus. So if someone who is looking to address volume and volume alone, then CoolSculpting will be maybe a better option for them. A lot of times in our stomach area, we also want to tighten the skin too and not just take away volume. So Morpheus will be a better solution for kind of all around treatment.
And would that be good for something, because I know we have Cool Mini to address fat right under the chin, but if somebody was trying to sort of contour their neck and jawline area, would this be a good treatment?
Absolutely. Yeah, depending on how much volume that we are starting off with. Sometimes we use CoolSculpting first to debulk, followed by the treatments for Morpheus to tighten and sculpt further.
Oh. Now, let's talk about, pain. Everybody wants to know, does it hurt? And I know sometimes lasers or therapy, certain treatments that we do can be a little bit spicy. And we have, plenty of solutions to get you through that procedure. So is Morpheus something that people find painful or pretty tolerable? Or I'm sure it probably depends on the person too.
Yeah, you're right. Everyone has different pain kind of thresholds. And one person's pain threshold may also vary from time to time too. Everybody who comes to our office for a Morpheus treatment, we will numb with topical lidocaine for at least 45 minutes to an hour before for maximal comfort. We also have medications in our office too, like Tylenol and something called gabapentin. Gabapentin is a nerve pain medication that people often are on every day for back pain, sciatica, pinched nerve. Because we're using these tiny little needles, a lot of times it's a nervy sensation that people would describe and be bothered by. So that is an option for you to take if you like. People who have or who want to have more pain control, we are also able to call in prescriptions for things like Percocet or Valium as long as they have a driver too.
And is this something that the what's the little laughing gas thing that we have? Pronox.
Yeah, nitrous oxide.
Is this nitrous oxide? So is that something that also could be helpful?
Absolutely. We have nitrous oxide in office too, and it's always a great option to kind of calm the mind, relaxes the person so that even though they're still experiencing discomfort, they're not as bothered by it. Kind of takes the edge off.
Now, have you ever had the Morpheus8?
I have. I've had it in my abdomen. I actually treated myself because everyone is super busy. Yeah. And from what I've heard, the abdomen, I guess, is more uncomfortable compared to the face just because we do penetrate deeper. It's a thicker area in that region. So I probably won't be doing that again on my own and have someone do it for me. But I'm loving the results. I am already seeing the tightness on my skin and also decrease in the volume.
Nice. And what would you have maybe compared that pain to? Was it like, I don't know, for the people in the audiences, I've never had one, but getting a tattoo or like laser resurfacing, or kind of, could you give everybody sort of a ballpark of how it felt?
Yeah. So on a scale of 1 to 10, and, the pain tolerance level differs from person to person too, 10 being the most painful. Majority of my patients will rate it around a 4, 3 or 4-ish. And that's kind of how I felt too, a little bit on my abdomen. But keep in mind, all I had was topical lidocaine. I didn't have any medications or nitrous oxide or any other comfort items that we offer here as well. So on a scale of 3 and 4, which is kind of mild discomfort, nothing too crazy, definitely nothing that prevents me from getting the treatment again.
Right. Now, how long does the treatment take usually? And then do we have any after effects afterwards in terms of pain or redness or swelling or goo oozing? I don't know.
Yeah. So on average, about 30 minutes per body area. So more area that we're doing. Very commonly, we are doing multiple areas in one treatment because when we are thinking about the downtime, I rather just recover all at once versus coming back for another area with, the same amount of downtime. You can expect about redness and potential swelling for the first 2 or 3 days, and it significantly improves after that. Compared to lasers, the downtime is much, much better. The redness, I would say, I treat all the staff here and they come back to work the next day. And I'm just so amazed and surprised that we just did a Morpheus treatment yesterday and they're able to come back to work the next day and look like nothing happened. So it's amazing how the recovery time is.
Well, I remember during the grand opening party that we had, Laura Kane, who's on the radio and has her own Laura Kane After Dark podcast. We did like a little live video, and she did a video of her treatment in the middle of the party, and people were watching her treatment. And afterwards, she came out and I was saying goodbye to her, and her face was like pink. I think they kind of did the lower part of her face, and she looked great. I was like really surprised at it.
Yeah.
And now, is that something you can put makeup on the next day, or what are your protocols for aftercare?
So the little channels that we are creating with the microneedling can take up to 3 days to fully heal. So it is recommended to avoid makeup until day 3 if you can.
Okay. And do you kind of avoid everything like sunscreen and that kind of stuff too?
Yeah. Same thing on day 3. You can start wearing SPF, tinted moisturizer, light makeup to make yourself more presentable to work or wherever it is that you're going. But if someone absolutely has to be outdoors within that first or second day, better to be safe and apply sunscreen. If you must be outdoors, then not wear sunscreen.
Yeah. Well, hopefully people, I'm sure, when they have a consult with you, you'd be advising them, where to fit it in their lifestyle. Like try not to have something, big in the first couple of days so that you can properly heal and heal quickly, excuse me.
Yeah.
Now, can you combine other treatments with Morpheus8?
Absolutely. We combine treatments that works in different modalities or different ways so that we can get a more synergistic effect and enhance our results. Depending on other skin concerns that the patient may have, such as, let's say, sun damage or hyperpigmentation, we can do the BBL, broad band light, to address those dark spots before we do the Morpheus. And you can do that on the same day.
Oh, wow.
We also often combine Morpheus with things like Sculptra and or Radiesse, right, to get a added benefit for that collagen stimulation.
Right. And that's something that we had a wonderful live webinar, which is now on demand on our website, with Amy Biggs from our La Jolla office. And she did a whole lecture on Sculptra and what that does and how it stimulates collagen. And then we have, at the end of this month, at the end of July, we have a live webinar with the topic is going to be Morpheus8. And so for any of you who are listening today or watching on YouTube and you want to see more, you can see some before and afters, and we'll, put in some video of somebody getting it done. We'll have that in the show notes so you can register, and because it's going to be really, really fun to kind of take this to the next level. But it's interesting. So if somebody had Sculptra, would they be having like Sculptra first and then the Morpheus8, or vice versa?
Yes, you can use the Sculptra first as long as you wait 2 weeks before you do things like Morpheus or any other treatment. So you allow your body to recover first before we move on to the next procedure.
Got it. So we talked about recovery. I mean, it's just a couple days, right? So, but how long would it take to see results from something like this?
Yeah, collagen stimulation definitely doesn't happen overnight. It does take some time for you to benefit from these treatments. On average, it starts about at week 4 and it continues to build after 3 to 6 months. So your best result will come 3 to 6 months after your full treatment.
I better get in with you because I've got my son's wedding in February. So I better get going. Yeah, I know. I'm really excited to do this. And now, it is good to plan ahead then, is what you're saying. So kind
Absolutely.
of, if you, like for me, I've got a wedding in February, so I backdate it and then get in. Now, so because of the ultimate timeline for seeing your results, 3 to 6 months, is this ever done in like a series of 1 or 2 or 3, or not a series? There's not a series of 1, but a series of 2 or 3, or is it really kind of a one and done for now, like one a year or something like that?
It is recommended to have a minimum of 3 treatments spaced about 4 to 6 weeks apart. In certain cases with deeper wrinkles, deeper acne scars, that 4th treatment may be needed to get to better results. And for maintenance, if we are doing it for correction, it is recommended to do it once every 6 months. If we're doing it more for prevention, then once a year to maintain that result.
Okay. So you're not having to wait to see the ultimate results of the first treatment before you have the second. You're going to like kind of build on each other.
Right. We are building on that collagen stimulation. With one treatment, you can expect about 15 to 20% improvement in skin tightening. And again, about 10 to 12% in fast sculpting, which is why after that 3rd or 4th treatment, you will see your best result.
Got it. Okay. So I'm assuming, so I was looking on the website, we have all our prices on the website, and it looks like the starting point for Morpheus8 is about $850 for a single treatment. And we do have Glam Fam, all our Glam Fam members save on everything. And so do you guys do if you have your consult with the patient, and let's say you're recommending 3 treatments, do you sort of have a package price?
We do have a package promo where you do purchase that 3 sessions, since it is recommended to have a minimum of 3 treatments. You get a certain percent reduction for the entire treatments that you are paying for.
Okay. And I think that's something that, especially it seems like with non-surgical modalities, let's say, or treatments, I think patients want it to always be one and done. And a lot of times it isn't. Like CoolSculpting, they say treat to complete. Like it's going to take at least 2 sessions in the same area to really get what most people would consider a good result. So I think that's important for us as the, potential patient to think about, you do have to do the whole thing. It's a lot of times when it's less invasive to our body, it's going to take a little bit longer. And usually that's the trade-off. We're not having to have surgery and have the downtime of a surgery, but we're going to have to build on the result to get you kind of where you want to be. Do you find that most people get that concept, or is it still kind of that people really want to just be done after one?
Yeah, so that's something that we definitely have to discuss during our consultation to set our expectations. For people who are looking for that one and done, who are looking for, the best result, surgery is definitely a better option. After that 3 or 4 treatments of Morpheus, you may improve in 40 or 60% for that skin lifting, tissue tightening benefit. If you're okay with that, Morpheus is a great non-surgical option for you. If you're looking for something more, then we would kind of discuss the route of surgical options.
Yeah. And I think, you mentioned a really great thing, setting expectations. That's for sure something that, we all have to sort of adjust our mentality, and our society is so much about, instant gratification. Yeah. Sometimes we have to be patient. These things don't happen overnight. Like you said, I mean, collagen remodeling does take a little bit of time, and the tissue is probably shrinking up a little bit. But when would you say that most of the patients who have Morpheus start to feel that they're getting a result?
I would say after 4 weeks. That is the soonest time, the earliest for collagen build to kind of be a little bit noticeable. When we have these 2nd treatments, 3rd treatments, and have patient come back for their next session, we take before and afters during each visit, and you can already tell an improvement from their first treatment 4 weeks ago.
Oh, that's good. That's good. And I guess that's probably motivating for them to know it's working.
Absolutely. And it's just going to get better with time.
For a consultation, do patients come in and see you, or is it something that you do like a Zoom consultation for?
We do offer the option for both in person and Zoom. I definitely recommend in person whenever possible, just because there's a lot of things that gets blurred from the photos. An in-person exam is much more valuable and more detailed than Zoom or photos.
And then do you have any like restrictions or pre-op, let's call it, even though it's not operation, pre-procedure tips for them to stop taking certain things or stop using certain kinds of skincare? Like, what are your prep
Yeah, so for
instructions?
preparation for Morpheus, you want to make sure you're avoiding sun exposure, actively sun tanning, tanning beds, oil, lotion, all those products 2 weeks before. Discontinue active ingredients in your skincare regimen, such as retinol or certain acid products, 3 to 5 days before, to make sure that it's not irritating your skin or having more reactions after Morpheus. It is contraindicated for people who do have a pacemaker, so cardiac implantable devices, defibrillators, because we're using radio frequency, which is electrical current, it may interfere with that.
Ah, okay. That's good to know.
Yeah.
Anybody else that kind of isn't a candidate?
No, Morpheus is great for people of all ages and also all skin types too, right? After age 30, we are losing collagen. So people do actually use this as prevention. It is safe on all skin types. So even people of darker complexion, we are able to safely treat too.
Oh, that's good to know. Yeah, that's really important, I think, because, there are certain treatments out there that, if you have darker skin, there's a higher risk of complications. And so that's nice that this is sort of good for everybody and all ages. Okay, so anything else that we didn't cover about Morpheus 8?
I feel like with the conditions or issues to address with Morpheus8 that you asked me earlier, I think I forgot to mention scarring, right? So not only good for acne scars, but it is also good for surgical scars too. So we actually see a lot of people after post-operative tummy tucks, lacerations that they just want to minimize or reduce the appearance, the thickness of it too. So it's an excellent option for that. Stretch marks too. A lot of people have stretch marks in their abdomen and the buttock region that we've been treating and also minimizing the appearance of too. So it's a wonderful option for so many different skin conditions.
So is there any, could you do arms with Morpheus 8 or what other, we talked about the tummy, we talked about the face and neck, but where else could we imagine that we could use this fun technology?
Yeah, aside from the face, neck, and chest, we also use Morpheus on the upper arms. A lot of times people have excessive volume in there and also skin laxity in the upper arms as well. Thighs too. So people who struggle with cellulites, we are able to use Morpheus to lessen the appearance of that too. Bra fat. So the back of the region where you have love handles, you really can't go wrong using this anywhere. I've heard that some practices are also using this vaginally too to kind of tighten the tissue after birth.
Oh, ow. I know. Sounds a tiny bit painful, but okay. Yeah. Needles and that region, I don't know. But you know what? If there's a way to solve what ails you, I'm all for it. So,
absolutely.
Well, that's very cool that, it has so many different kinds of applications that you really could probably get really carried away with this, but that's why we have it. So, anything that, as a provider that you're doing it for people and you've had it yourself. I mean, anything else about it that you want to share?
One of the, I think, preparation into Morpheus8, we recommend to discontinue aspirin, Advil, Aleve, any blood thinning medications unless it is medically necessary. Some people do have to be on a blood thinner every single day for medical conditions, and we definitely don't want them to discontinue for elective procedures such as Morpheus. We're still able to treat if you accidentally took in Aleve or something like that for headache in the morning. The only thing is that you would expect more downtime, so more risk of bleeding and bruising, potentially swelling too. It does not mean that we can't do it. So no worries if you accidentally use something for your headache in the morning, just let us know and we'll kind of prepare for that.
Okay, that's good. And I'm guessing, it's probably a really good conversation and why you have a in-person or on Zoom consultation to kind of go over that patient's specific history, what they're taking in terms of medications for what different, ailments they have, and being able to kind of help walk them through what they can continue to do, what they might take a break from.
Yeah, absolutely. Also go over their medical history too, such as cold sores. If we're treating the face around the lips, because we are stressing the skin, creating trauma around that area, we want to make sure we are treating you preventatively with some antiviral medications to not have a breakout after Morpheus.
Yeah, that's a really good point. So thanks, Anastasia. It was really fun to talk to you again today. And everybody, you can see Anastasia in Carlsbad, and her patients, I have to tell you, they just rave about her. Every day we have, new reviews coming in, and I'll see the really nice things that people are writing about her and how good they feel about, her natural touch and just how your aesthetic eye, I guess, is really able to help them achieve what they were looking for in a way that still feels like them. So anyway, we'll have all those links for you guys, and then you can set up your consultations and or some of your treatments online on our website, and we can also put that in the show notes, so you can click to book now. You can book your Botox. You can book a lot of the different things, but for sure a consult for Morpheus8 as well. So thanks, everybody. And we will see you on the next podcast.
Thanks, Monique. Take care.
Thanks.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Ximed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.